afternoon. Today is Thursday, March 23rd. It's a little after 1 p.m. and the Washoe County District Board of Health is called to order. Madam Clerk, can you do the roll call?
Yes. Chair Jung.
Present.
Dr. Novak. Absent. Oscar Delgado.
Here.
Dr. Hess.
Here.
Christopher Dare.
Present.
Michael Brown is absent. We have a quorum.
Thank you very much, Madam.
You're welcome.
Item number 2 is the Pledge of Allegiance, and I see Chief Cochran back there. Would you mind leading us in that, sir? Thank you.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thanks, Chief. Madam Clerk, please call public comment.
There is none at this time, ma'am.
Okay, thank you. Item number 4 is the approval of agenda, and the district health officer does have a change that he'd like to request in the recognitions area. Mr. District Health Officer, what would you like to change
I
here?
would like to move Bob Sachs' retirement to after the Little Hats, Big Hearts presentation.
Okay, great. So we're taking that off, Mr. Sack, and you can't retire. That's what, no, just kidding. That's what that's kidding. We want to make sure we give our due grace to you and put you at the end, because 30 years is quite a long time. So with that change, do I have an approval of the agenda? I have a motion by Hess, a second by Delgado. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Mr. District Health Officer, please take it away.
All right, so we have recognitions for years of service, and so the way we're doing our recognitions is I'll recognize people and then stick around and we'll do our pictures with the board at the end. So first I have Mr. Robert Sack being recognized for 30 years of service with the Health District. So Mr. Sack, if you could stand up and we'll... We're not done with you yet. And we have Dr. Lei Chen, who's the supervisor of our EPI program with 15 years of service with the Health District. And we have Gracie Flores. OA2 is Gracie able to make it today? She's hard at work with 15 years of service also with CCHS. And then we have a new position of Advanced Practice Registered Nurse, Christine Ballou. And Mr. Cutts, if I could ask you to make an introduction for us.
Okay, I think this is on,
Yep.
yes. Okay, good afternoon, Madam Chair, members of the Board of Health, Steve Cutts for the record. So I'd like to introduce Christine Ballou. Chris is a board-certified nurse practitioner, and she has been a nurse since 2005. She has 3 years of urgent care experience, and she worked at the Minute Clinic in CVS most recently. She's always been interested in public health. She's jumping into everything very quickly, and she was incredibly impressive in her interview, and we are thrilled to have her with us. So welcome, Chris.
Welcome, Chris. Looking forward.
All right, next we have a promotion to recognize Matt Christensen. He has been promoted from Environmental Health Training 1 to Environmental Health Training 2 in EHS, but I don't see Matt here, so I believe he's out in the field. Okay.
Thank you, Mr. Sack.
So congratulations to Matt.
Congratulate him anyway.
All right. So then next I'd like to move to a presentation and so that they can be recognized for the Little Hats, Big Hearts program. The American Heart Association with St. Mary's Regional Medical Center. And we have Helen Lidholm here along with Jessica Sferraza and Jamie Ubaldi with St. Mary's. So.
Madam Chair, members of the committee, for the record, my name is Helen Lidholm. It's Lidholm. the things that St. Mary's is doing that will promote health in the community. You got a little slide presentation. You also have some gifts. The first thing I want to talk about is St. Mary's has partnered with American Heart Association for a long time. We entered into a multi-year agreement to make sure that our community remains healthy and gets healthier. And we're going to be focusing on inspiring our community to stay active, eat healthy, and rely on medical teams for their healthcare needs. The first program that we are going to introduce is next.
Yeah.
You
Well,
have it?
there we go.
Thank you. It's called Little Hats, Big Hearts. And what we're doing, you should all have a little hat in front of you. So volunteers at St. Mary's and volunteers throughout the community, me included, I hope you didn't get one of my hats because they're a little crooked. We knit little tiny red hats. And the idea behind that is to bridge the gap between a newborn baby and a senior. Many seniors, I love you, have the heart. Thank you. Many seniors like to knit, and there's so much correlation between early childhood congenital heart defects, and then of course we know what happens as we get older. We want to raise awareness for children born with heart defects and help their families focus on their long-term health. And so we have now received over 200 little hats that are exclusively made for babies born at St. Mary's. So the idea is that every baby born will receive a little hat. And we're making them in different sizes. We figured out that some are born with little heads, some are born with bigger heads. And, we also have pediatric department, so we're making the hats for those kids as well. On the next slide is an example of one of our team members, Dr. Bayo Curry-Winchell, who graduated with UNR School of Medicine, Family Medicine Residency Program. She's a life force in herself. She's just amazing. She has a daughter who was born with a heart condition, and she is very much involved in this. And her little latest baby, second daughter, is wearing one of the red hats. And then you're going to see a picture of the hats that, I think maybe the one down in the corner there with the tall, that may be one of mine. I've got to get better at making them a little bit more even, but it's really fun to do. The next slide talks about how the community can get involved. We are asking the community to get involved in everything from donate materials. If you're not a crocheter or a knitter, you run through Walgreens or Walmart and you see a red yarn, it costs $1.97. Ship it over to St. Mary's, we'll get a hat knitted. Tell a friend, share your story. If you have somebody in your family or yourself that are living with heart condition, we would really like to feature our local community in our efforts to make not just St. Mary's, but Northern Nevada heart healthy and healthy for good. And we are also using social media to spread the network, hopefully in a more positive way than we see recently. So on the next slide, there's another program that we're just starting, and it's called Little Steps, Big Gains. And we want to move to get healthy. And we would like to invite this board and other elected officials to participate in this Little Steps, Big Gains, not giants, challenge to make sure that we all get moving and that the constituents in our communities see us and know that we don't just talk the talk, we walk the walk, we take the steps to create a healthier Northern Nevada. And that concludes my presentation, and I'm really thankful for your support. I'm really happy to be here today, and I'll be happy to take any questions.
Thank you so much. Any questions, Councilman?
I heard, did you knit these, Mrs. Lindholm, at all, or any of these?
Not all of them, some of them.
The word on the street is that she knits really, really well. And so I know the Rice family has Nikki and Trevor had told me that they got the in with you. So that's, I'm trying to get somewhere, because I got twins, 10 months old. Maybe there's an opportunity to get a knitted little hat. right?
Okay, I don't know if it's permissible, Madam Chair, to make a deal, but I
Make
just
a deal.
made 2 hats for little Lily, and if those fits, you'll get
There it goes.
2 for
No,
yours.
Thank you. I think this is tremendous. Thank you for coming forward. I know it's no secret, of course, to this board and to the community that we need to be out a lot more and physically active a lot more. We've seen the repercussions of obesity and diabetes and everything else in our community. So
Right.
you guys taking the lead on this is great.
Thank
So
you.
Thank you.
Thank you for allowing me the time.
Yeah, anybody else? Councilman Dare?
So on the 5th, when it kicks off, is there something happening we can come to show, we can get in our gear and come walk with you? Or is there some form of this, or do I just go walk in my neighborhood and yell at how great you are? What would be the best way to
If
do
you
it?
visit, on that slide, there's a website, stmarysreno.com/move more to get started. Jamie, who's the brains in the family, can tell you more about it.
Absolutely. So on April 5th, we are sending our fitness trainers to some of the large employers in our community, but St. Mary's is also a host site to kick off our own 1-mile walk. So we'll be sending out information to nearby companies, including your organizations, to get you involved, and we'll have a starting point, and we'll all walk together, and we'll hope for some sunshine that morning or
Wonderful.
afternoon.
Wonderful. So you'll let us know then when that's going to be.
Absolutely.
Thank you.
Thank you.
Yeah, the District Health Officer, Kevin Dick.
Well, I just wanted to, Ms. Lederholm's here today, thank her for being here, but also to recognize St. Mary's participation with Truckee Meadows Healthy Communities. Jamie Ubaldi used to serve on our steering committee for quite some time, and Chris King is member of our board now, so I just want to acknowledge that also while you're here. So,
Happy to
thank you.
participate and help in any way we can.
We appreciate you.
very much.
Thank you for the presentation.
Thank you.
Thank you.
All right, that takes us to item 5D, retirements. Mr. Robert Sack. District Health Officer, Kevin Dick.
Yes, so I guess it's my honor, but sort of a sad one, to congratulate Mr. Sack on his retirement after 30 years with the Health District. We do have a small token of our appreciation, and it's a clock that we have for you, Bob, and it says, Washoe County Health District recognizes Robert Bob Sack for 30 years of dedicated service, 6/23/1987 to March 31st of 2017. I had the opportunity to attend the Environmental Health Services Division General Staff meeting this morning, where they had a special recognition for Mr. Sack there. There were a few wet eyes in the room. And so there are many people in his division that are sad to see him going, but we wish you very, very well, and I really appreciate the opportunity to work with Bob and the support that he's provided for me and the job he's done for environmental health.
Madam Chair, if you don't mind, I'd like to say a few words.
Absolutely.
I just wanted to thank the board for allowing me the opportunity to continue to serve this community and protecting its public health for the last 30 years. And I especially, as division director, each of us works closely with the board in all of its forms and people. And just wanted to say that I appreciate very much the job you guys do and the interaction you have with each of us as division directors. And thank you very much.
Thank you, Mr. Sack. And I understand Ms. Sack is also retired. So,
In the audience, I have my wife Lynn, my niece Carrie Ann, my sister Joanne, and my daughter Lauren.
isn't that wonderful?
Yeah.
Great. Well, let's get up here and do a photograph.
You're not off duty yet.
We have Dr. Chen, we have. Okay, should I go back to work? And then we have the St. Mary's too, they didn't leave, did they? Yeah, they just did too. Thank you. Me? Balancing. Congratulations, thank you so much. Is that it? Yeah. Thank you. Thank you. We have a new voting system too, electronic. Yeah, because we had a certain member that wouldn't cast her vote and then come back and say she didn't vote that way. Yeah. Congratulations to everyone and to the Sack family, and happy trails, and I'm sure I'll see you around. This is still a small town. See you soon, Lynn. All right, that is not any circumstance vis-a-vis action items. So let's go to item six, which is consent. We can look at all of them in one motion, or if you would like to pull anything out of the consent, please let me know. Otherwise, I would entertain a motion.
So moved.
I have a motion by Novak, a second by Hess. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Item 7 is our public hearing, presentation, discussion, and possible adoption of the proposed revisions to the District Board of Health regulations governing air quality management, sections 040.080, gasoline transfer and dispensing facilities, and related 0.010.00 definitions. Miss Albee. Oh, you're not Miss Albee. Miss Albee's proxy.
Good afternoon.
Mr. Wolf.
Good afternoon, Madam Chair and the Board. For the record, Mike Wolf, Air Quality Management. I'm here to present the staff report for the proposed regulation change for gas station dispensing facilities. Our proposed change really is just to remove the Phase 2 vapor recovery requirement. We're not requiring them to remove the vapor recovery, just the requirement that they have it. So I know you've all had the opportunity to read. Any questions?
any questions for Mr. Wolf? All right, this is a public hearing, so let me open up that public hearing belatedly. Is there anybody here from the public that would like to speak to us before we,
Not at this time, Madam Chair.
okay? I would entertain a motion. Okay,
Second?
I have a motion by Novak, a second by Dare. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Item number 8, Mr. District Health Officer.
Thank you, Madam Chair. Our next item is a presentation on the state of Nevada's Integrated Source Water Protection Program and concurrent update and development of a Truckee River Watershed Management Plan. Discussion and possible approval of staff recommendation to submit a letter in support of the program. And I have Mr. English to make introductions.
Great.
For the record, James English, Environmental Health Specialist Supervisor, Safe Drinking Water Program Manager. Who I have here today from the Nevada Division of Environmental Protection is Kim Bosinger and Bridget Henson, who is going to go ahead and give this presentation, and then I'll give a brief summary asking for your support. Thank you.
Thanks, Jim. For the record, I'm Kim Borgsener with the Nevada Division of Environmental Protection, and I work in the Safe Drinking Water Bureau. And I'm here today to present to you a planning effort we're getting started to protect the drinking water sources that we regulate at NDEP. You can actually go to the next slide. This program is a voluntary program. The state of Nevada is mandated to have this program available to the communities, but we've made it voluntary at the local level to participate. It's basically a plan that helps local public water systems to protect their drinking water wells and drinking water sources, in this case, the Truckee River and the wells in the valley. Next slide. So a lot of you guys, this board knows, but a lot of the rest of the population doesn't know that there are 78 active regulated public water systems in Washoe County. And in those 78 active public water systems, there's 200 wells with the Truckee River watershed that supply the water to this community with a population of over 400,000. So right now in the planning process, we're trying to build our stakeholder group and get a lot of transparency through presentations to the different boards and get invited to come in and do this work in the community. And what that helps us to do is to make sure that the boards support our planning effort through designating staff time to the planning effort. There's no fiscal contribution at this time, but we definitely need the staff time to participate in the meetings and help guide the process because it really is a stakeholder-driven process. And then what we do at the end is we bring this plan back to the boards to show you the results of what that plan looks like to get your approval. So we essentially need to be invited to come into the community to do this work. Next slide. Right now, we have a lot of planning. We've picked Washoe County. NDP targeted Washoe County a couple years ago, mainly because this community has already participated in and developed the One Truckee River Plan that was recently adopted. And one of the action items in that plan is to participate in the Integrated Source Water Protection Program and do watershed planning in this community. The Truckee River Watershed Management Plan currently got approved for some updates to update that plan. And the Western Regional Water Commission is now in the process of updating the Regional Water Management Plan. And there are overlapping goals and components to all these plans that just fit really well with what we're trying to accomplish with drinking water protection. Next slide. And so you might be asking why now? With the current planning momentum, we've also had an opportunity at the state to leverage a couple of different programs, which I'll let Birgit go into a little more of that as she does her part of the presentation. But we've essentially been coordinating with the Regional Environmental Protection Agency at the national level, and they would like to see us leveraging programs that do have these overlapping components. And this is one of the few communities in Nevada that does have a drinking water, surface water source, the Truckee River, as well as multiple wells in the community. So this is our first opportunity to really leverage two different programs at the state and provide a bigger benefit to the community by considering the Truckee River watershed as well as the different wells in the community. And I'll let Birgit talk a little bit more about what that looks like with her program.
I need to lower the mic. Kim and I present a lot, so it's fun to be the mic lower. Good afternoon, Madam Chair, members of the board. My name is Birgit Henson. I'm an environmental scientist with the Nevada Division of Environmental Protection, and I manage the non-point source program. And just to let you know what that means, because that is actually EPA speak for surface water quality and any kind of pollutants that are coming off of the land, including your urban pollutants from urban areas, agricultural pollutants, anything from your uplands, including erosion, et cetera. So basically, I'm talking about Clean Water Act, water pollution quality control. Basically, in Nevada, the non-point source program receives funding through the federal government of EPA to mitigate and reduce non-point source pollution. This includes these local funded groups that do the planning. And as Ms. Borgsinger already told you, there's a lot of these efforts already happening in Washoe County and in the Truckee River watershed, including the One Truckee River Management Plan and us moving in to look at the source water protection in the area, should we be invited to start that process. The main benefit for the non-point source program to be involved in this planning effort is that it opens up a large amount of funding. I suppose that's a relative term, but for this program, a larger amount of funding for the community to implement their pollution control projects on the ground that they would otherwise not be available to get. And as you see in this slide right here, we get about approximately $1 million a year that we can pass through to the entire state. And right now, the majority of that funding goes to the Carson, Tahoe, and Las Vegas watersheds because they have watershed management plans in place. And with that, that's really brief, but I'd like to open it up for any questions you may have.
Great, thank you. Councilman Dare.
I have a couple. One is, so you mentioned grants and possibility of open finances. Are you going to work, I think it's a redundant question, I know the answer, but I want to say it out loud so we can kind of move forward. But how will you work with our people to make sure we are aware of what type of things we can continue to go after? Because even being on this board, I've watched that we actually do a pretty wonderful job of trying to find any money out there that they'll give us, and this will open up that door. And you guys have done your presentation, and they'll be in Sparks, by the way, I think Monday. I think yours.
Yes.
Yeah.
Yes, we do.
And so, but what kind of grants possibility might there be, and what kind of stuff should we look for? Or is that in the future to come that we can look for that, or what do you
As a result of this planning effort, once all the stakeholders, which includes staff, if you approve, to have them support this process, as well as the jurisdiction, City of Reno, City of Sparks, Washoe County, and other stakeholders that are involved, create this planning effort, and it is approved to move forward, we are anticipating to have a list of projects that those different entities are going to prioritize to be a part of that plan that will then be able to move forward to look for various funding, including the 319 funds I mentioned in my presentation, potentially source water funds, and there are some other, of course, funding sources in this watershed that they would then be able to move forward to look for money from.
And then the other question you mentioned is staff time. Obviously, time is money, so when we say there's no
True.
money needed, that's kind of true. What kind of time and what kind of staff out of this particular set, what would be expectation? What are we saying yes to there?
We are currently putting together a stakeholder group, and we are anticipating that there will be 2-hour meetings that are being held every 6 weeks. Let me confirm. About once a month, every 6 weeks. So that is the time commitment at this point. There would be also potentially other review from email interactions that we'd be asking staff just to look at some different documents that are put together to ensure that they're correct and appropriate. So that may take some additional time.
Thank you.
Thank you, Councilman. Any other questions? I think it needs to be noted as well is that while that's an in-kind donation, so to speak, because it's staff time, but staff really looks forward to doing these types of professional development. Am I correct, Mr. English? This is something that they are passionate about, subject matter experts about, and would love to get on board with a regional plan to improve our water quality.
All right.
Mr. English?
Thank you.
Thank you.
So as you mentioned, staff is fully supportive of this. We do believe we're looking at about 12 to 20 hours a year of staff time presently. And right now, as you are aware, the Safe Drinking Water Program has a state grant through NDEP, so that time will actually be charged to that grant activity. So this has been a request of NDEP to assist in building this program up. We believe this will be utilized for future planning activities. One of the key goals we hope to have is a very sound document that when we comment on development reviews for the cities and county regarding new infrastructure, new buildings, new business locations, that we can say there's a intake for the Chalk Bluff sewer, or water treatment plant, or there is a well in that area, and we would highly recommend you look at a different location for that warehouse or that hazardous materials handling facility. We believe that this support falls into the District Board of Health strategic priority for a healthy environment. We believe that having this plan will give us a good backbone to do planning and provide sound comment on development in the future.
Great. Dr. Novak?
Is there anything that you Is there anything you anticipate down the line, other than some staff time at this point, that would be needed?
No, not at this time. What I have understood in the planning process going forward is what they really need is our information. We have a tremendous amount of information regarding where the wells are located, both the public and the private ones, and we also know where our hazardous materials facilities are, our underground storage tank facilities are, and some of our other infrastructure for this community. So it's more providing them that electronic data that's already available through public information and just coordinating some of that and answering some questions.
Thank you.
Other questions? All right, no other questions. I would entertain a motion to approve the staff recommendation to submit a letter in support of the program.
I'd like to make a motion that we support this and continue to watch this unfold and supporting our staff. And I think it's wonderful. It's a good job.
Second.
I have a motion by Dare, a second by Novak. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Thank you so much for being here. Item number 9, REMSA. 9A is the review and acceptance of their ops report for February of this year. And then 9B, which is non-action item, is an update of REMSA's public relations during February of 2017.
Good afternoon, Madam Chair, members
Hi,
of the
Mr.
board.
Von Arx.
Don Von Arx from REMSA. Happy to answer any questions you may have about the February compliance report you have in front of you.
Anybody have any questions? Okay, so with not, that is that is not the action item. Oh, it is the action item. Sorry about that. Let's go ahead and get a motion on that, and then we'll move on to the rest of yours, since that's the agenda business. I would entertain a motion to accept the franchise compliance report.
So moved.
Second.
I have 3 of these. I have a motion by Novak, a second by Dare. Any further discussion? Hearing none. All those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Now you may proceed.
Madam Chair, Kevin Romero is not here today. I have one update.
Okay.
We've been working with EMS oversight and incident command up in the Lemon Valley flooding area.
Thank you.
We have now staffed an ambulance at our Red Rock post 24 hours a day for more timely response into that area that's cut off from the south route. So we'll be watching that and working with, as I said, EMS oversight and IC to make sure that EMS resources are available.
We sure appreciate that. That has been a major disaster for us as a county out there, and for you to move your ambulance in regard to the way we've had to close down the access to the area. We appreciate it. Dr. Novak?
Has this been mostly just an access movement right now, to station the ambulance out there? Or have you been seeing an increase in demand for services, or?
No, we haven't seen an increase in demand, and we have already, was part of our plan to put a base at the Red Rock Post, so we had that luckily. But the southern access from Lemon Valley Drive is
so
completely stopped. So, you know, response times aside, there's a lot of surface streets and residential areas we have to go through now. So that really makes for a timely response, makes a problem. So moving it to Red Rock we've been measuring those times now, and we're very good. We're right within well below the standards, actually.
Good.
So,
Terrific.
great, thank you.
Councilman Dare?
On a different note, I wanted to thank, I got the opportunity to come out and do a tour and do a drive along and go save a woman's life. I'm just kidding. We didn't deliver a baby or anything, but it was really cool. Thank you, JW. And I got to tell you, it's fascinating to watch the whole thing. Obviously, I'm newer, so I'm in the learning process. You guys probably already seen all this, but if you haven't, I'll tell you that it's a fantastic thing to do. The more we see, the more we can understand what you guys do. And I didn't realize this. One of the things that I was pretty impressed with, and I think, I don't know, some people avoid meetings, but they actually meet every day to go over how the day before went.
Wow.
And I got to tell you, that's efficient, and it's a lot of hard work because people don't get along that well to go in. There's some people I don't want to see every day. I just be honest with you. But I got to tell you, I was pretty impressed watching, and they did a great job. And I plan on going again. I didn't give as much time as I wanted, but it's an awesome time. Yeah.
You're an awesome councilman.
Yeah,
You
thank
really are.
Well, thank you.
I love your enthusiasm. Any other questions? Thank you, Mr.
Thank you
Von
all.
Erx, and please tell Mr. Romero we said hi. Item number 10, Mr. Kevin Dick, update regarding bill draft requests and bill drafts for the 2017 legislative session. I'm sure you got a bunch dropped on you on Monday, which was the deadline for all of those to be in.
Yes, and so I apologize for just providing you today with the table and the summary. And I apologize that it says February on the top of my text report. That's March. If you could strike that out, you'll see in the next line, as of Monday, that was the deadline for the legislators' bill introductions. We had 1,161 bill draft requests that had been filed, and 480 assembly bill drafts and 425 Senate bill drafts. So Ms. Rogers and I have been scrambling through this morning and as well as the division directors and staff, comb through all these bills, over 100 new bills since Monday that we're reviewing to try to figure out what's going on and what our position should be. So I guess what I'd like to do is to highlight some bills for you that are contained within the report and the table. And Ms. Rogers has cautioned me that the table may not be completely up to date, so if we find any additions to this, we'll forward something out to the board. One bill of note as far as a large fiscal impact to the health district is AB 344, which is the plastic bag bill. Would require until 2021, I believe, is the date that customers be charged 10 cents per bag in retail establishments, and after 2021 would ban plastic bags in all retail. That bill called for annual inspections by the health district and enforcement by the health district. And so since it's all retail establishments and we don't regulate all retail establishments, that means the addition of a significant number of staff to be able to support that. And our estimate is about $2.5 million fiscal impact to the health district.
Per year?
Per year. And so.
What, do you know, excuse me to interrupt, why did they put it on the health district to be the person who is the guardian of this law?
Thank you for asking that question, because this is really not a public health
At all.
issue. And so we don't think it's appropriate that responsibility, that burden be placed on the health district for enforcing the provisions. Even if we were to establish some sort of a fee structure to all retail establishments to support our costs, we don't have a place to put all these people physically. So it's a huge additional responsibility and workload with associated staffing that it would impose on the health district. So we'll be engaging in this one and seeing what we can do to remove the health district from that responsibility.
Yes, Dr. Hess.
Is there a system, I'm trying to find 344.
It's the,
So
It doesn't seem like there's a system.
it's it's numeric.
So they're sorted in that document that you're in the first part being bills that directly affect the health district.
Okay.
So as you go through the ABs.
Page 6.
On that page 6, thank you. AB 344. Yeah.
I'm with you, George. Give me a minute.
And let me also, for a little coaching for the system, the legislative summary table is sorted by bills that we're tracking as being the highest engagement by the health district. So this one has the bills that we're tracking right up at the top of the list, and then we go down to bills that we're monitoring or aren't paying attention to. Sorry about that. The next bill I wanted to mention, so is SB 315, and this one is on
The back.
Page 10 of 30?
Page 10. This one is for the State Environmental Commission to study and make recommendations regarding agreements for waste disposal, so franchise agreement type stuff, looking at how construction and demolition waste and recyclable materials are handled, perhaps setting additional recycling goals. So our concern is that if this is tasked to the State Environmental Commission, that through the State Environmental Commission, that the health district will eventually have a bunch of these responsibilities falling down to us. So we're currently sort of neutral on this, but we may change our position because this is just another one of those bills that we just saw in the last couple of days.
Right.
And as we're figuring this out, we may end up going to opposition on this if it looks like this is going to be something that's more than we're prepared to take on. The of interest, I would say, is I wanted to just mention AB 366 because there's been a great interest in behavioral health, and that's called out as a priority in our CHIP. AB 366 is a bill that would establish behavioral health regions in the state. And Washoe County would be one of 4 behavioral health regions. Southern Nevada
That's awesome.
Health District area would be their behavioral health region. And each of the regions would have a policy board that would be comprised of different representatives from that community area that are designated under the bill. So I think that's just an interesting one to watch as a development of an approach toward devolving a little bit from the state level for mental and behavioral health services to a regional approach within the state.
Question on that.
Councilman Dare?
Is that in hopes of them divulging some of their, getting rid of some of their responsibility? Or is that in hopes of something we would like, because then we could be more hands-on? Is that part of why you're watching it? Because it would feel a little bit like that could be problematic in some ways, that all of a sudden they're.
And this is one, I can't tell you who, off the top of my head, who the co-sponsors are on this, but it's individual assembly people that have put the bill forward with a number of different co-sponsors on it. So it's not coming out specifically of a state agency or committee representing them, and it looks to me like it's incremental, and it's not to that point of actually putting the burden on Washoe County, for instance, to provide those services, but I think we need to watch it to see what happens with it.
Because in light of what we've heard, if you watch the news, they're obviously defunding things on that end. And so when they defund, you know what that means. It's going to have to get done somewhere. So if all of a sudden this is rising, I could imagine that they would try to pack that suitcase with things we might not want.
Yeah, and from what I saw in the bill, the role of that policy board is to provide input and direction about what types of services should be provided and what the priorities should be for that region. So it's getting toward more input into the type of services delivered, but it's kind of silent on the funding aspect of it.
Yeah. Our input could cost us a lot of money.
Lovely.
That's true.
Any other questions? Do you have
Okay.
more to go over?
I do have
Okay.
some more for you, if you'll bear with me.
Yes.
AB 307. This is a change in the EMS services for special events.
Oh, yeah.
And so as you'll recall, several sessions ago, the state took the District Board of Health's guidelines for special events for EMS and ambulance services to be provided, and they developed state regulations, NRS, based on the Washoe County District Board of Health guidelines. AB 307 would raise the threshold, population threshold, to 700,000 for those NRS requirements, and would change the requirements in every county with less than 700,000 to it being approval from local government, either city or county, for special events, including reserve transport units that are provided. So we've placed an opposed position on this because we feel like it's a rollback of the guidelines that the District Board of Health had established for special events and that the state had followed. AB 113, this is the bill to provide for nursing mothers, and we were concerned originally that the bill had a provision that required district boards of health to provide mediation for work and workplaces on this issue, and that is there's been an amendment proposed by the sponsor to pull that out of the bill. So we're pleased to report that.
So we're mediators as well now. We're retail
Not anymore.
enforcers and mediators.
It was a close call on mediators.
But only if it's 700,000 or more.
Right.
A couple of interesting ones. AB 397 this is an exempt bill because it's a budget bill, but it provides a $4 million appropriation from the general fund for family planning services. This kind of goes together with SB 122, which we've supported and provided a letter of support for, that creates a state account for funds for family planning that could be provided to local governments for those services.
Good.
So it's kind of a backstop with all the stuff that's going on with the Affordable Care Act and with Title X. And AB 388 is another exempt bill because it's a budget bill that would provide $1 million per year appropriation for Women's Health Connection over the next 2 years of the biennium. Again, a way of providing some funding there. SB 152, this is the classic vehicle plate bill. Ms. Albee went down and testified in support of that at the committee. This bill has got some opposition from SEMA, which is an automotive parts manufacturing group. And we don't exactly know why, because we think that actually requiring a classic vehicle to be something that's classic and not a heap of junk falling apart would provide them with more parts sales. But we'll see how that's resolved. I think that Ms. Albee maybe made some progress with the committee in educating them on that. We've got a couple of height and weight bills, SB 165 and SB 273. The SB 165 is Mo Dennis's bill, and it includes a definition of obesity in it also, in addition to having the schools do height and weight measurement. SB 273 is the bill that came out of the Interim Legislative Committee on Healthcare that Assemblyman Oscarson presented the other day, which is just height and weight measurement, bringing back the sunsetted provisions. So we're in support of both of those. The Nevada Public Health Association voiced our concern on the one that included a definition of obesity, that we didn't think that was necessary because there was already guidance from the American Medical Association. We didn't think it needed to be something codified in NRS, which makes it inflexible if anything changes with that down the road. Washoe County School District is opposed to height and weight measurement and put a fiscal note on that bill.
Dr. Hess?
I'm sorry, do you know why?
They are opposed because they say it's additional work on them. They do it the day that students are having their vision exams and scoliosis and that sort of stuff, so it's kind of like they're all in line. But they claim it's 292 nursing hours and some other number of 8 hours that it takes, so it's inconvenient for them.
According to them.
Yes. SB 355, this is a bill that would provide for grief support services, and it's funded by a 2% of the money collected from death certificates that would fund the grief support program. And so we're currently neutral on this, but looking at it because that $2 per certificate for us is our preliminary estimate, somewhere around $46,000 of fiscal impact. It could be that we could decide to increase the fees, but we haven't worked that through to be able to make it neutral for us. But we're still kind of sorting through SB 355, and if it doesn't look like we've got the possibility or that it's advisable to try to raise our fees to account for that 46,000, we might be in a position of opposition.
Dr. Novak?
What kind of counseling are we going to provide for this money?
We wouldn't provide it, but it would be provided through the State Department of Public and Behavioral Health, or Division of Public and Behavioral Health, and then for grief counseling for people that have lost loved ones, those types of things. I don't know if Dr. Todd has got anything additional that he could add to that.
Dr. Todd, if you did, please come down to the microphone so that our recording secretary has you on the record.
Good afternoon, Randall Todd for the record. I don't really have anything additional on that bill per se. As Mr. Dick mentioned, it would take $2 of the fee we currently collect, which is out of a $20 fee for each death certificate that we provide. It would take $2 of that out of our coffers and put it toward this special fund.
To the state.
To the state. Now, in conversation with the State Health Division, or the Division of Public and Behavioral Health, as they're now known, earlier today, the person in charge of vital records indicated that the Southern Nevada Health District, they already have put on a local fee on top of the $20. So in Clark County, if you want to get a death certificate, it costs you $33, not $20. And they would envision making that $35 if this bill were to go through. So the suggestion was that we might consider increasing our fee, but that would have to be a decision that this board makes. Right now, you don't take any action on the vital records fees because we simply use the state approved fees as they stand. So if we did it if this came to pass, we'd probably come before you asking for a fee increase.
Sure.
I would add, though, that we figured all this out at about 11:30 this morning, and we haven't had a chance to even engage Ms.
No, I get it.
Aberrand about fee increases and what our options even are.
It's crunch time, we know.
That's true. And it also makes making change at the window a little bit more difficult.
Right.
Right now it's $20, so we get $20 bills. If it was $22, then we'd have to start stocking a lot of singles. Or we might
Make it 30, I guess.
make it $25 and then we could be dealing with fives.
Okay.
35, whatever, just kidding.
Yeah, and again, in conversation with the state, when I floated the $25 idea by them, they said that seemed to be fairly in line with what other jurisdictions in the region are charging for death certificates. So we're a little low compared to a lot of places now. That would put us somewhat in line with what other jurisdictions charge. And as I said, Clark County is 33 now, and they would envision going to 35.
Right. All right, any other questions?
I do have one. So you're
Councilman Dare?
with the grief portion. We obviously never want to just send out to one person, puts us in a liability situation. If people are going through grief, and we have this, do we have people who would register? I mean, are we not that far yet? Maybe we don't know these answers, but would we be asking if people would register, and then we'd somehow put anybody who has a license to do that, or?
My understanding from reading the bill is that that the money would go into a special fund, and then people at the state level would select the providers who would provide that service.
That was a question.
Any other
Okay.
questions?
I've
All
got
right.
just a couple of
Couple
other
more.
things kind of to wrap up. We're still awaiting a bill to come out from the interim legislative committee on healthcare that was on e-cigarettes and vaping, to add those to the Clean Indoor Air Act. So that should be out by next Monday is the deadline for the committee bills. We haven't seen anything yet as far as a smog check bill for revising the smog check program. There was a lot of work that Ms. Albee headed with a subcommittee, the State I&M Committee, with some recommendations on how that might be changed. So we don't know if that's going to be forthcoming or not, but we're watching for that. There are a whole bunch of healthcare-related bills that have been introduced, many more than we've seen, I think, in previous sessions because of the concerns about what's going on in DC with repeal and replacement of the Affordable Care Act. So a number of bills that are set up to require that Medicaid and insurance in Nevada cover preventive services, maternity and newborn babies, family planning, contraception, those types of things. There's a bill, AB 374, that I'm calling sort of the Medicaid for All bill. It would allow other people that don't meet the Medicaid income limits join Medicaid as basically their health insurance plan at 150% of the median for Medicaid. So whole bunch of bills that are going on around Medicaid and health insurance. That was AB 374. And then there's a whole number of marijuana bills. And so toward the end of the big document, I actually put together a whole bunch of the marijuana bills. I think we're neutral on most of those. I don't anticipate engaging actively in any of them. I just wanted to mention, though, that Tick Seger-Bloom does have one bill, it's SB 236, which provides for being able to have and use marijuana at special events. And I put us as monitor on that, but as opposed due to concerns about secondhand smoke type impacts. But we don't intend to engage. All the other ones I've just kind of put neutral on the marijuana stuff. But like I said, we're
Any
not
other
planning
questions,
on
comments?
engaging.
Well, I know that you had to scramble to put this together, and perhaps next month, if you have time, and I know this is all changing even as we're speaking, if you could put these in order of the actual number. I know you
Straight
tried to
through.
put it together, but I think it's hard for us to flip back and forth. Is this chip related? Is this, so if you could just put it numerically,
Yeah.
and then you can walk us through it. And I think another thing that would help us that we've done in the past is if you could make this like a dashboard with the yellow, monitor, red is opposed, green is, no issue, if you have the time. Because I know this is changing, and poor Miss Rogers, I'm sure, is like, yeah, that's another job for her to do. But this is, it's such a moving target for us as well, and we'd like to be able to give you feedback in as best as we can when we're at this position.
No, I appreciate those comments, and I think maybe what I could do is put these all numerically, and then maybe a better way of doing it is just put at the end, tag it to a CHIP or the community health needs assessment or
Right.
whatever.
It's just,
Okay.
thank you, though. I mean, like I said, I know it was a scramble. Any other questions? Yes,
I have
Councilman
one.
Dare.
So, not trying to even start a conversation whether people agree or don't agree or like marijuana and stuff like that. One of the views I would like to know a little bit from the health, the hat that we wear on that, what anticipated things are we looking at? Do we need to keep an eye on? You mentioned it's coming up in the law and stuff like that. We're neutral and then some opposed and that's that. I'd want to make sure, I'd like to have a conversation of seeing, from your guys' point of view, from our staff's point of view, what things will we need to be watching for in affecting this? Obviously, there's, in a very real way, unless something comes from federal, it's been passed, it's happening. And so with that moving forward, opinions don't matter at this point. It matters how do we lead forward and do the best we can for our city and for our employees and making sure we're being wise. So I would like, I don't know that perspective, and I would like to grow that perspective a little bit.
Okay.
And you might want to work with Washoe County as well as the city of Reno, because we all have white papers on some of those issues and what we are proposing as cost recovery programs and education programs, et cetera. So, because I know that Sparks has their own dispensaries as well, and so it might be nice for this to be the clearinghouse that says, this is where we bring it all together, these are the concerns, these are the, right?
Yeah,
I
I
mean-
agree with that.
Would this be,
Dr. Novak?
would this be something that we would want to have a special meeting over, a special education, kind of seminar over? Because we're in kind of a time crunch to a certain extent too. For educating, I guess, all three entities plus ourselves.
Mhm.
And obviously, by the looks of the bills, nobody down there's got a lot of guidance either, so.
Well, that's our job.
Yeah,
That's our job. Let's think about that, if there needs to be a special informational meeting or educational.
not necessarily an action item. but-
Right, right. Good idea, thank you. Any other comments on item 10? You don't need any action from us at this point, do you?
I guess I'd appreciate if you could
Just
accept.
accept the report? I would entertain a motion to accept.
I'll move, we accept the report.
Second?
I have a motion by Hess and a second by Novak. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Item 11 are our staff reports and program updates. Air quality management is item 11A. Ms. Albee, do you have anything additional to report? No, any question on Ms. Albee's air quality report? Good job. All right, thank you. Item 11B, as in boy, is community and clinical health services update, and that's Steve Cutts, the director. Do you have anything, sir?
I have nothing further to add, but would be happy to answer any questions you may have.
Any questions for community and clinical health services?
This report was very well done. A lot of information in there.
Mr. Cutts is a rock star, yeah, truly. But he won't be the district health officer, he's retiring.
Him too?
Yep, they're all going.
Are we going?
Yep, yeah, they're all going. I already tried to,
Last one, turn
I
off
already
the
tried
lights.
to recruit him, yeah, no, won't happen. Our final, or is it our final, when's your last day, Mr. Sack? You need to get up here and give us an environmental health services report, just because is this your last one forever? Oh, my goodness. You'll be watching from home every month, though, I know it.
Oh, yes.
Texting me, asking me to ask questions.
Yeah, Bob Sack, Division Director of Environmental Health Services. Yeah, I've been looking forward to the day where I can pull all the things that everybody else does.
Is that today? Let's see it. What is it?
No.
Are you high, or what, like
No,
what?
No,
That's the way I
wanted me to
came
come
in.
up. I do not have anything further to add. We will be adding some flood update stuff associated with the health officer's update.
Okay. Appreciate you. Any
And-
questions? Yes, Dr. Hess. Grill him.
I have a question under the waste management, that very last little paragraph. Are we gonna get a report on what remediate the problems were and how they were remediated at some point, or is it that serious that we need to, or I didn't know quite what to do with that. That was a two-liner almost, two-liner in a word.
Yeah, the reason why that's included in there is there's, appears to be some litigation associated with the whole waste management industry, not just the company, but a number of issues, both at the city level, and, we're getting dragged into some of that. We're having to do a lot of effort to produce public records right now. But I'm not going to mention the name or anything at this point because it is an ongoing enforcement action for us that's, we're actively working. And so basically the point of it is that us and the city did inspections out at a recycling facility and found a number of violations, and those are being actively worked on by both the facility and overseen by us.
Any other questions?
Yes, I do.
Dr. Novak.
Mr. Sack, are we watching the vector, management and mosquitoes and everything else at a little bit increased level?
Yeah, we'll be given a little bit of an update on that also as part of the flood
Okay,
issues coming up.
thank you.
I will
Councilman
say one
Darren?
thing as you finish out. I just got back from a trip to another country where they don't do all this, and I really appreciate the last 30 years of what you've done. The mosquitoes, all of it, and I'll just tell you.
One of the attractions for me of this career is the varied disciplines that we're involved with on a daily basis. And so that goes across all of our staff too. So we do a lot of different things, and I think we do it very, very well.
I agree.
Jamaica might need you, so if you,
Any other questions? Thank you, sir.
Thank you.
Item 11D as in dog is epidemiology and public health preparedness. Dr. Randall Todd, do you have anything to add? Any questions for Dr. Todd? All right, that leaves us to 11E, Office of the District Health Officer, Mr. Kevin Dick.
Thank you, Madam Chair. I'd like to begin with a report out on the FY 17-18 budget. As required in the interlocal agreement, I met with the city and county managers. In attendance were Manager Driscoll and the Assistant Manager Christine Volatech from the county. Bill Thomas had been invited and confirmed, but he was out of town and unable to attend. I presented the budget, discussed it with the managers. Mr. Driscoll inquired about what our ability within the budget was to, if we had one-off type projects that we wanted to pursue and to fund, and I explained to him that we did have professional services within the budget and other services and supplies that we had budget expenditures under that we could use for those purposes. And he then also commented on the ending fund balance. I discussed with them, as I discussed with you, our concerns about what may be happening with grant funding from the federal agencies that we rely on, and told him that we'd approach this kind of conservatively with that in mind, and he appreciated that and thought that was a good approach, and appreciated the ending fund balance that we had. So that was really the extent of the comments. I did see Bill Thomas after we had sent him the budget information, told him that if he had any input that he wanted to provide, I would brief you on that today, but I haven't heard anything further from him, so I'm assuming that he's okay with the budget that we presented. We also met with the county budget staff to go over the budget with them. In regards to the North Valley's floods, the flood, the health district's been very active. Together with the county and Truckee Meadows Fire Protection District, we established a unified command, and we put Battalion Chief Sam Hicks in charge of the incident command team. We've been engaged with the incident command team. Mr. Jim English has been our primary representative on that team up at the REOC, 7 in the morning for the morning meetings, 6 at night, and a good part of the day in between. We've had Phil Uliberry representing the health district as part of the Joint Information Communication Team, the JIC. We've had the preparedness, emergency preparedness and planning group involved with the signboards and AM radio broadcasting stations up there for messaging. We've had our Medical Reserve Corps volunteers out knocking on doors and providing assistance for people. The Environmental Health Services staff have been engaged in working with residents on issues related to wells and septic systems. We've provided water sampling kits for the residents on wells up there. Fortunately, we've been finding for the most part that the wells are not impacted. And so that's a good thing. We've been doing some surface water sampling of the flood waters up there as well. We're telling everybody, presume that it's contaminated. We are finding some contamination, but not high levels of contamination, fortunately, but that can be very kind of spotty in a situation like this. But I'd welcome Mr. English to get up, and he's got the front row seat in all of this with his participation down at the REOC. Happy to get an update from him.
Good afternoon, members of the board. James English, Environmental Health Specialist Supervisor. I was tasked to help coordinate the health district's response to this incident up at the North Valleys. And as I mentioned last month when I was representing Mr. Sack down here, we were fully engaged and aware that we had a potential situation up there on the environmental health side, along with some public works issues. So with that said, on March 1st, I went up to the EOC to meet with Aaron Keniston with Christina Conte to discuss some planning and what may be taking place and how large the scope of the actual issue was. With that, we gave them some direction on the public health and the environmental health issues that we saw that were going to be an issue at that point in time. As you were probably aware, over the weekend, the event got quite a bit larger, and they decided to move into unified command with Sam Hicks as the incident commander. Since that that was done on Monday, March 6th. The Health District has been fully involved in that unified command. Kevin Dick, our health officer, and John Slaughter are in that group. I'm representing Kevin. At the current time, we have been staffing the REOC as requested by the incident commander, but we are up there pretty much from 6 to 7 every single day. The week of the 6th, the Health District went ahead and worked with the emergency planning side to come up with the short-term and long-term plan. We wrote the disinfection protocols that are being used by all the first responders out there the first week. We also evaluated the original rounds of surface water data, and since we were a regulatory agency, EHS took over that responsibility right away. We also determined that since there was such a public concern regarding failed septic systems and contaminated residential wells, we started up a proactive well sampling program for bacterial results, which the health officer mentioned earlier. We've passed out over 250 sampling kits. We've gotten about 75 back. We have also tested Swan Lake, Silver Lake, and Whites Lake twice a week throughout this entire event with staff. We've actually been in the water pulling the surface samples. We're reporting that back up through the IOC. I've been working closely with 3 different safety officers. The first week, the week of the 6th, when the USAR task force team was up here, it's pretty interesting. Their medical officer was Dr. Hess. He had a couple of individuals fall into the lake and was concerned about contamination. I was able to release the testing results. We also spent that first week working on a long-term environmental plan. That included the vector component for these 3 bodies of water. Although it looks like we're only concentrating on Swan Lake and Lemon Valley, we are also constantly monitoring Silver Lake and Whites Lake. We put together over the course of the first weekend a full surveillance program at the request of the IC for mosquitoes. We have both our New Jersey traps deployed in the Swan Lake area, and we've also brought out 6 CO2 traps. And we are currently seeing mosquito activity at this time. We are reporting that back up to the incident command team, and they've gone out and purchased DEET for all their first responders and insect repellent. We have also put together a plan to proactively treat by larviciding all 3 bodies of water up there. It's pretty conservative, but it goes throughout the course of this spring through early fall. We fully expect water to be in that lake all year long for the first time. We have also written a long-term response plan for the ongoing recovery of this event as we move out of the initial response now that the wall's built. If you were to look at the incident action plan today, you would see that the health district has the actual largest role outside of the boots on the ground, finishing off the wall and maintaining the pumps. We currently have the coordination duties for waste management, for hazmat response and hazardous waste characterization, for mosquito surveillance, for surface water sampling, for residential well sampling, and we are coordinating the county's damage assessment teams. Environmental health and building and safety are already currently going out and evaluating the structures out there at this time. Today I have over 12 staff members that are working parts of this event. And with that, we have moved our division into an ICS role to backfill their daily work. This has become quite a task going forward. In the past pay period, we spent over 400 hours responding to this incident, which has included assessing homes on Sunday. We have worked closely with the EPHP. They have offered some assistance to provide some information and created a handout for us to give to residences with commonly asked questions, also regarding well issues and septic issues. We were asked by the state to provide some assistance regarding mental health and disasters, which the health district isn't usually in their purview, but we have staff in the PHP was able to put together some information for the public meetings. We've been present at all the public meetings. We've been present at all the command decision-making meetings, and we have continued to provide assistance where requested. Currently, as we move into recovery, I see the health district having an extremely long-term, sustained role in this response between repairing up to 160 septic systems in the valley, looking at rehabbing or requiring water connections, and moving forward with mosquito abatement. As part of the long-term goal, since I had the opportunity to work with both state DEM and federal representatives, we did go ahead and put together a plan that covered all the the various wetlands within Washoe County. As these public meetings were held for this event, you would see residents coming down from Rancho Haven, from Palomino Valley, for Washoe Valley, all wanting to know how their communities were going to be affected and what was going to be done to mitigate either septic issues, well issues, or mosquito issues. So we have provided Washoe County, the actual county, not the health district, a proactive plan to larvicide the community to protect against vectors and mosquitoes going forward. And that followed the federal guidelines for potential reimbursement. But we have fully, as I mentioned last week, we knew we were going to have an issue, and we were right there at the beginning. So with that, I'll answer any questions.
Any questions for Mr. English? Councilman Dare?
I do. One of the questions, well, first of all, wow, awesome. Yeah, that's
Nightmare.
you guys, that is wonderful. And part of that is I hope to find ways that we can help everyone else see how awesome it is that not just our health group, but everybody, we really attach and we go after it. I wanted to know, because in the midst of this, in the future, is it possible that we get updates on emergency type things of what's going on? Because we can help control the narrative. Because sometimes when we hear the narrative, even, for me, and I'm on this board, sometimes I don't hear all this. I hear what everyone's not doing, according to the media and things of that fashion. And we can help. I mean, my Facebook, my things, and I constantly am putting stuff out there when I know what we're doing. And I'd love to help the narrative, because sometimes if we don't control the narrative, obviously somebody else does. But what a list of an amazing thing that I hope people who are even getting frustrated, we can say, hey, look, we're doing this. And some of them might not, I'm sure you're trying to get them to know, but the more we can know, the more we can. And this is a great update, but this would have also been good in the future, like as it was going a little bit. I did, in our city, I get stuff all the time when stuff's going on. Is it possible to ask for that? Is that something that we've done in the past? I don't want to put more work on you, but I think in some of our positions we play, we have a pretty good reach, and we probably can help really get that out there.
Yeah, I think, just to respond to that, I think we could put out some more information, but a lot of the information is put out in coordination with the JIC through Washoe County press releases and information on their side. So I don't know if you're on the distribution list for those.
I don't even know what a
Make sure
JIC
you-
is, so probably not.
The Joint Information Command.
Okay.
But it would be emails that would be
Yeah.
coming, so Washoe County update on the flood. So since we're part of the Unified Command, we operate with them for the outreach. But what I'll do is make sure that everybody on the board is on the
Please.
distribution list for those
Yeah, because I
updates.
just think, kind of as a board, I get the opportunity to really highlight all the great things that we are a part of. And again, what an amazing list of stuff. But truly, it's stuff I didn't know we were doing all that, which tells you if I don't know it, well, maybe I'm not paying attention, but I'm trying to. Other people who aren't paying attention don't know that.
It's a good request. He needs to, the whole board needs to be updated on that.
As part of this response, we did finally go ahead, EHS did start a Twitter account. So I'll provide the health officer both our Twitter, I guess it's a handle, I'm sorry, I don't have one, and our Facebook page. We have worked really hard to push out public messaging with our communications manager, Phil Yellowberry, and the JIC, both through the website, Facebook, and Twitter. So if we can get all the members on the board to sign up for that, I think our outreach would be a lot greater going forward for EHS.
Dr. Hess?
Testing the surface water, from a medical point of view, are there any contaminants that you're finding that we need to get worried about? Arsenic and I don't know what else, lead?
Not at this time. We did a full panel at the beginning. We sampled in the exact same locations that NDEP did, because there is a sewer treatment plant inside the flooded area, which is completely sound at this point in time, Washoe County operated. Also, the Reno Stead sewer treatment plant discharges effluent into that same basin. We went ahead and tripled that testing and added some BTEX components, some petroleum components, which we'd be concerned about because we are getting questions regarding sheens. We tried to do some public outreach regarding how much a drop of Dawn dish detergent will do on a body of water or a drop of gasoline. We have looked at all the data, and I can tell you that we're well below recreational lake levels for contamination. We have some point locations that have E. coli in them, but it's well below what would be in any recreational body of water. I know this is being televised. We're not publicly stating that
swim,
to
right.
swim in the lake, because we don't need any more people down there trying to see what's going on.
Right.
But it's very clear the water is snow melt and rain runoff.
That's good news.
I have one question regarding that.
Councilman Dare?
Do we have, because when we have problems down Sparks, we deal with mercury and things like that. Is that a problem in that area at all?
That is not a problem historically I've known about, so we did not do any testing for that.
Okay.
Any other questions? Thank you.
If I could just follow up as a comment on that, since we've got Chief Maples in the back of the room, I just wanted to commend the job that Chief Hicks has done in leading the incident command team and all the progress that he's been able to accomplish with that team. Oh, I'm sorry.
That's right, he's one of my guys.
My bad.
So you're welcome. I am on the Board of Fire, and he has done a great job. You're very welcome, District Health Officer.
Yeah, there
Yes,
are.
you did,
Thanks.
absolutely.
Maybe that's why I was confused. He wears a white shirt.
Sparks!
Just wanted to mention on the Acela Regional License and Permits Program, the cost for the next year's subscription, we're currently in discussions about what the health district's appropriate share of those costs is. The way the contract was put together, we had a set number of seats that we subscribed for at a given cost for those people that are using the system. The jurisdictions have revised their numbers upward of the number of people that they want to have subscribed to the system in the future. I think the health district did a pretty good job of figuring out how many people we actually needed, so we don't see a big increase in our users next year. However, the increase in the users from the other jurisdictions is causing the cost for those new users to be higher than the cost for subscription for our current users. And the formula that's been put together has basically shifted a whole bunch of those costs onto the health district when they're not for our users. And so we're hopefully resolving that in the next few months to our favor. But it's almost doubling our subscription cost with the way that's set up. So I just wanted to bring that to the board's attention. I guess in regards to the budget and what Mr. English was talking about with the mosquito abatement in the North Valleys area, that's several hundreds of thousands of dollars that would cost both this fiscal year and next fiscal year that aren't included in our budget. We've had discussions with the county budget office regarding those expenses that would require us to go to Board of County Commissioners and get an augmentation to our budget to be able to provide those applications. With the emergency declaration and the work that's been done, these should be FEMA reimbursable costs, but FEMA doesn't pay up right away. And so it's a cost that would need to be borne until we've got reimbursement in the future from FEMA. I wanted to...
How are we doing
Dr. Hess?
the reserves then? I mean, do we need to have a budget look-see here pretty soon?
I think at this point, since it's an emergency situation and there's the opportunity for the FEMA reimbursement, our first course of action would be to go to the county to request the additional funds as far as the authority to expend in the appropriation for those funds to move forward.
Any other questions? Dr. Novak?
I got several questions. I'd ask about, have we increased our vector surveillance for Reno, Sparks, the local area, not just the flood area?
I'll let Mr. Sack handle it.
Bob Sack, Division Director of Environmental Health Services. We are planning on doing the normal surveillance that we have, which is adequate for even with the added floodwaters. We do, however, have limited funds for the larviciding and helicopter applications. We've got enough money to do one helicopter application of about 250 acres between now and the end of the fiscal year at the end of June. Right now, we have 2,000 acres is what we would anticipate would need to be treated probably over multiple times to effectively, do some sort of disease control with these mosquitoes. So that's why, if we're going to go down that road, there's a lot of money that needs to be spent, and any of the health district's reserves are not really shouldn't come into play for that, because you could blow through any reserves you've got real quick. But we do not need, we have all the surveillance we need, the same areas, there's just more water, but the surveillance that we're doing out there, that we do every year, is adequate for the amount of water we have.
Good, that's,
Yes.
also, is the Accela, are we up operational and really running this well now?
We are up and operational. We are continuing to work to resolve issues with the software and how it's running, where there are bugs in it that we're fixing. We're also continuing to work on the workflow process, the way the workflow occurs between the three jurisdictions, the cities and the county and the health district, since we end up working with each of those jurisdictions in plan reviews, and how that workflow occurs coming from their offices to ours in the system, and our information on the review and the plans getting back to their offices and being understood and addressed in a timely manner when it gets back there. So I would say we are up and running. We are continuing to work on
And this is
resolving
part of the negotiations
problems
on
with it.
increase in fees and stuff?
It
seems to me we're a year or so behind.
The implementation that we expected from Accela under the contract that we had with them was not performed to our satisfaction.
Any other questions?
So do we have
Dr. Hess?
recourse then? Because it seems to me that they owe us money. Because they have not, they have
We've been
not provided
wrangling
what
with
they
them as a
told-
region for over a year.
Yeah, it's a difficult situation because our first objective is try to get the software to work like it's supposed to, and so we can continue with our functions. And we think that they owe us more. They think that we owe them more. I think what we're just trying to do is at this point try to get through the process to get something that will be suitable for us to use for moving forward.
All right.
I wanted to do just a quick update because I put graphs in the back, some bar charts of the results from our quality improvement survey. And you'll see that we've had some decline in some of the responses that we've had from staff this year. I think this reflects a couple of different things. One is that workload has increased dramatically, both between the Accela system and people, the issues that are getting worked through with that. Some of the implementation of Patagonia that happened in CCHS for our electronic health records and getting familiar with that new system, but also the uptick in our service demand and strategic plan things that we're working on. So people are saying that they have to worry more about competing priorities when they're working on quality improvement. I think in some respects that's a good thing because it means we don't have people sitting around waiting to do a quality improvement project because they have nothing else to do. But what I'm told by our statisticians is that while it looks like we've had some declines, there's nothing statistically significant in the changes. But one of the changes that occurred is we've gone from 90 people that responded to our survey in 2014 to 83 that responded in 2015 to 117 that responded this year. So we have more engagement. We've actually done some things to remove like what division they work in, that's what level they are in the organization that makes it more anonymous. And I just actually came across a blog the other day that says the more anonymous a survey or review, the more the feedback turns from critique to criticism, and I think we're seeing a little bit of that as well. But I think overall, still pretty good support for quality improvement and the work we're doing, and we've seen some good results from that I highlighted in here. We currently have a workforce development survey in place, so we're working with UNR and to assess what the training needs, professional development needs of staff are. So that we can develop that into our workforce development plan and get some training delivered that's focused on what needs are identified from the survey results. Also related to workforce, I wanted to inform the board that we have posted the job announcement for Mr. Sachs' position. We're doing a national search for recruitment to fill that position.
Good.
I just met with the Environmental Health Services staff this morning to talk with them about that. I'll be meeting with the Environmental Health Services supervisors on a weekly basis, and working with them to manage and lead that division forward in the interim. I'll be assessing with them whether we decide to do any sort of rotation of supervisors from month to month if we've got that vacancy open for a continuing period. But as I explained to the Environmental Health Services staff, I want to make sure that I don't rush into filling that position, recognizing that the decision we're making now is going to have long-term implications for Environmental Health Services, and making sure that we're finding a person that we feel is appropriate to lead that division. I've got several people externally that have agreed to participate on the interview panel with me. That will be an appointed position as Mr. Sachs is now.
Great. Any other?
That's my update.
Thank you for your update. Any, Councilman Dare?
I have two questions, one regarding the job and then something on here. So is that particular job, you said it's national search. Do we not hire internally, or is that just a given?
It's
I
an
just didn't hear you
open
say
open
that.
recruitment, so it's open internally as well. And so
Okay.
we'll consider all candidates.
Thank you. I just wanted to make sure we
Yes.
clarify that.
Yes.
And then secondly, one of the concerns, not concern, I mean, obviously, we're mushing, I think leading is like pushing mud uphill sometimes. You just do your best and things fall and things do its thing. And so, it's true, it's like raising kids or whatever, it's all the same. You kind of keep pushing. But on this particular one, this one, working well with other programs and divisions, that's been significantly not as high as everything else. And I think sometimes it's a purposed thing I see in groups that you have to actually push for. Since that's on the back question 2 at the Washoe County Health District, I work well with other programs and divisions to design improved services. Some of that, when you have as many different areas as you do, and I think they all respect each other. I don't think that's a question. When I went around, I didn't see anything. I've been in every group you've had, and they've been very respectful of each other, but they still vie for their thing. And so I would ask if there's anything we're doing, if there's anything in the future, or we should look at that can help bridge some of that. Because if we don't, I think we're going to significantly just see this continue to either lower or stay where it's at, which that value in seeing each other sometimes can be a very crucial value to an entity like what we do. So that's just a leadership opinion of when I lead groups, that's actually a pretty significant question that I would like to see arise in, if it's possible, and put somehow some attention to.
Thank you.
Anybody else? All right, that takes us to item 12, board comment. Does anybody have announcements or issues for future agendas? I'll start to my right here.
Thank you.
All right, thanks. I don't either. Is there public comment?
No, Madam Chair.
Thank you. With that, we are in adjournment.
Good job. Good job.
Does anybody have a baby? Because I don't.